Welcome everybody to the Birds and BBV Bite. I've been joined by Rena D'Souza from the Telethon Kids Institute, and Rena is here to talk about the Motivate C project. My name's Veronica Walsh. I work here at the Aboriginal Health Council, and before we start, I would like to acknowledge that we are presenting this bite on Whadjuk Noongar Boodja, beautiful lands here in Perth. We'd like to acknowledge the traditional owners of the lands, pay our respects to elders past, present and emerging, and extend that respect out to all people who are listening to this bite. Okay, so Rena. Hello.
Hello, Veronica. Nice to see you again.
Nice to see you again too. I'm so interested to hear about this Motivate C project. I know that, working with Aboriginal Community Controlled Health Services, who are so keen to get people who have Hep C treated. And there's just a small majority of people who just are just difficult to, just to be able to take the treatment is not always so easy for people, and they're the hard to reach people sometimes. So something like this project might just fill that gap. So I'm really keen to learn more about this.
And thank you for the opportunity to talk more about this unique clinical research project. It is the National Hepatitis C Clinical Research Project. The aim of the project is to ascertain whether providing a person a financial incentive when they have a Hep C infection would encourage them to initiate treatment when they haven't done so before. This is also a randomized adaptive project. So it's not only we're trying to ascertain if financial incentives work, but what is that minimum amount? What is that optimum value? Okay. This project is funded by MRFF, the Medical Research Future Fund, and we have drawn insights from behavioral economists to assist us with the design of this project. So we've seen that perhaps education hasn't been a strong motivator to encourage people to initiate treatment, where providing them with a financial incentive, the immediacy of providing them a financial incentive when they initiate treatment, not lumping it with other like tax benefits or any other social benefits, for example. Providing it in a cash or card form. When we mean cash is over like a debit card, a Visa gift card. So it's the immediacy of all that. And we've also been able to draw further insights through consultations with consumer representatives. That has helped us with writing of the grant proposal and writing of our protocol. And we also have two consumer representatives on our steering committee that will guide us through the rest of this project.
Yeah, that's so good. Yeah, okay.
So just to kind of give you an idea of the project, maybe we can move to the next slide. So this project, like we said, the aim is to ascertain if providing financial incentive to a person living with hepatitis C would encourage them to engage in treatment, adapt a randomized trial. So that's one arm. A secondary arm or an aim of this project is to also ascertain if providing the clinician a co-incentive payment would also encourage to initiate treatment. Okay. So with regard to our payments, we also have a compensation payment. So it's compensation for a person going and getting themselves tested to confirm their Hep C status, and that's $105. And they get a randomized amount if they're positive and they get onto treatment, and that amount that we are studying. And that amount is anything between getting nothing actually or up to $1,000. For the clinician, for the GP, they could be either randomized nothing or $100. But in case a participant does not have a GP or does not want to go to their clinician, we have 5 clinicians on our project that will provide bulk bill and telehealth services.
That's great. Yep.
So that's just a summary of the project. And what I will do is just give you further details on how this works as we kind of go along.
Could that be a nurse practitioner as well?
That can be a nurse practitioner as well.
Okay.
So who can take part? So people who are eligible for this project, they should have known that they have Hep C diagnosis through a blood test, either recently or historically. They need to be an adult, 18 years over, Medicare card, not been on treatment for the past 6 months.
Okay.
Minimum requirement is that they need to have a mobile phone.
Yes.
Because that's the only way they can communicate with the project and with the representative project, which is our project navigator.
Yes. Okay. Yeah. Okay. Which I think there is a lot of people that have a mobile phone, even those that are homeless.
Yep.
So,
but we do acknowledge.
But you acknowledge that it's not everybody. No.
But we need to have kind of a baseline to be able to contact. So what our hope is through the results of this project,
yes,
we can offer a pragmatic, cost-efficient solution or strategy to eliminate Hep C, but also that everybody will get that bracket amount to be able to get onto treatment and
it creates that privacy as well that person feels by just using their phone. Yeah.
Our prescribers, we're looking at this project is starting a project in primary care. So nurse practitioners, GPs prescribe S85. That is again, so it's not tertiary, it's more about primary care. And our project navigators are our biggest assets. They're the interface between the project and the participant, between the project and the prescriber as well. We've got navigators in WA as well as over East, because it's a national project and catering to participants from different states. And all our navigators are, trained and GCP trained and
So I was just saying to Rena before that I know a couple of the navigators and have met them and have spoken to them, and they're just lovely people.
Very
at the other end of the phone.
So how does this project work? So right now there are posters, flyers, cards, and fit packs, which look like the image on the left-hand side of the screen. Simple, clear, positive messaging. There's another one there. Clear, positive messaging. There's a QR code over here, as well as your address, which takes the person interested to the project website. So that's the middle image on the screen over there. The project website has all the information about the processes, who's eligible, how does what are the different requirements at every step. Also just gives it an idea of who's involved in our project, our partners, the different investigators, and our collaborators, our supporters of the project, like the different health departments, like WA Health Department is one of them.
And they've also got like smaller cards as well, which I think are really handy. They look very much like the poster, but they're a smaller card with the QR code on them that you can actually order as well through Rena or the website.
So if a person feels that they're eligible for this project and they want to register, the register button, if they're looking at it from their phone by clicking on the register button or typing in the mobile number that's highlighted on the register button, and texting in register to that number would initiate on the left-hand side of your screen SMS chat box that goes through the eligibility, highlights all the eligibility again. And if the person self-identifies, they have to type yes for then the next chat box to open up, which discloses their randomized amount. So the message can say $200 has been allocated by the Motivate C team to engage further. If you with the project navigator, please type yes to proceed. It's only after they type in that last yes will the message then come saying that, okay, now project navigator will contact you in the next 3 business days to discuss the project further.
Okay.
So it's only when we get that last yes, it's giving us the implied consent for us to engage with this person again.
Yes. Okay.
So once that's done,
can I just ask, how long does it take for a navigator to ring you back after you've hit yes?
It just depends on the time of the day. But if it's like Monday to Friday, within the business working hours, it can be as quick as 10 minutes. Up to a couple of hours.
Okay.
Yes.
Okay.
So it can be the same day. literally.
Yeah.
Because the navigators get a notification right up front.
Yeah.
But because this is a national project, they are dealing with
Yes.
across
Yes.
the country.
Yeah.
So it just could take. But if it's like a 5 o'clock on a Friday,
Yeah.
it will be on a Monday.
Okay.
Yeah.
And how many navigators in WA?
We have got 1 navigator right now in WA.
Yes.
And 2 in over East.
Yes.
But it does not mean that the Eastern States navigators are not handling WA participants.
Oh, so they could be.
It could be.
It could be anybody.
Anybody.
Okay, so they ring you up and go, hi.
Yep.
You know, we've just heard that you're
Correct.
interested. Okay, and then
Correct.
take it from here.
Correct. Are you happy to have conversation now?
Yeah.
It could be a couple of text messages that is like alerting the participant that, or the individual rather, that we have received their registration.
Yeah.
Is the time convenient for them to have a conversation now?
Yeah.
So you can go back and forth a bit, the texting or the phone calls, and then we'll say, okay, now it might take 15-20 minutes. Do you have the time? And that's how it starts.
Okay.
Yeah.
Okay. Oh, that's awesome. All right. Great. Will I move on?
Move on. Thank you.
Yeah.
So this is how the whole process of the journey. So it starts off with the registering via SMS, getting the contact with the navigator contacts the participants within the time frame. Once the time is agreed upon between the participant and the navigator just highlights what is required, the processes and the procedures. We say we have got to go through eligibility to see, because this is clinical research project, so there are process that we have to adhere to.
Yes.
We go through formal consent. All this is done over the phone.
Okay.
We make sure that the participant has read the information sheet, which is on the website. Yep. If they haven't, then the navigator goes through the participant information sheet. Make sure that if more time is required, either sends them the link to the participant information sheet. So it can be this whole process of the first conversation and going through eligibility consent could take maybe a day or two or a couple of hours. It just depends, because we want to be sure that the individual is well informed, understands what they're kind of getting, understands what is a requirement.
Yes, but also understands maybe what Hep C is.
Hep C is correct. So so that's kind of done in that initial conversation. And then the navigator says, okay, now do you have a primary care provider, a clinician you can go to and get engaged with? Yeah. So if they do have one, we just get the details of the clinician, so that we send information to the clinician saying that potentially a participant from this project will be coming to you for testing and treatment of Hep C. If you're unsure of testing and treatment, we provide them all with the ASHM tools and guidelines. And we also say that if the clinician has been randomized, you've also been randomized an amount to be part of it. If you initiate or prescribe, if you want to opt out, that's an option as well. So that's just sent out like a blanket email. We do not give any identifying information of the participant either. No. But this information is also provided to the participant if they want to take it along with them when in their meeting with the clinician. The navigator also offers to fix an appointment with that clinician for the participant, but we try to get the participant to do that on their own. And we tell them it might take 2 weeks for you to get back, with your test results and all, whatever else, but make sure that you're aware of the time frame of the project, because from the time they register to the time that they've got to show us all the different results and to verify, it's 12 weeks. Yes. For them to be eligible to get the payment as well. Yeah. Okay. Now, if, for example, they do not have a clinician, we've got 5 clinicians on our project that can provide bulk pill and telehealth services, and one of our clinicians in WA is from the WA hepatitis WA. Yeah. Okay. Yeah.
Okay. Okay. And then, what information do you need about the participant when you go through that registering?
Just their name, their date of birth, and gender.
Okay.
And the reason we need the name and date of birth is to match when they show us their test results over the phone. Just to match the name of the test results to them. We don't keep any of the details. We don't ask them to send it to us. It's just more verification purposes that this is the same person that's along the journey with us.
So you don't need to know Aboriginality?
No, nothing. No. We don't ask. We don't, we ask them just where they're from state-wise to guide them, in terms of answer time zones, or to guide them if they want a clinician, within their state. We help them find. It's for that reason only, but otherwise nothing else.
Okay.
And the only extra bit of information we collect from them, because we will need to send them their payment incentive, which is normally done either digitally to their phone,
Yeah.
like a digital gift card,
Yes.
or if they prefer, a physical card is sent out to them.
So-
That's the only time you get their mailing address.
Okay, and then they would have to consent to wanting to have a hard copy, like a card or whatever.
Exactly.
But otherwise, they would just do digital, and
Exactly.
you wouldn't need to know their
Correct.
address.
Exactly. And that's why they need the phone.
That's why they need the phone.
And we always say it's the digital gift card will be sent to that phone and that phone number.
Yes.
Because that's we can't send it to any other phone, or
No.
it's their identifying.
Yeah, which is
yes.
good that you've also got the choice to send it to their address as well,
Correct,
because
correct. In
that,
case they lose
that
their
could be an
phone.
issue for some people.
Yes, that could be an issue
Yeah.
for some people.
Yeah.
Not enough data.
Okay.
So
Yeah.
once they have to go over to have the appointment with their clinician. They're going to come back with us with their test results. If the further test was required by the clinician to confirm their Hep C status, if the clinician is happy with previous test results, it's up to the clinician and the individual. So we don't get involved in the care
Yeah.
and the treatment.
Yeah.
So we just need a verification. If, for example, the clinician decides with those results, they are happy to prescribe immediately, and the individual or the participant has to go and fill that script and show us the bottle
Yes.
with their name. So it's not only this, we don't want to see the script, we need to see the bottle,
Yeah.
which
Yeah.
has the details again of their name and
Yeah.
the prescriber
Yeah.
and how long is the course of the treatment, because
Yeah.
that's when the next contacts will be with
Yes. So it could be 8 weeks or the
or
12.
the 12 weeks.
Yeah.
Correct.
Yeah.
And also
Okay.
the date of prescribing, because we do not want an old script or
Yes.
and then coming in.
Yes.
Because it's all about after engagement with the navigator.
Yeah. Okay. Okay.
So then
Yeah.
the navigator fixes the time with the participant saying, okay, now when you start treatment, can we check in with you in 2 weeks? So again, that time with the meeting is scheduled with the navigator and the participant.
Yep.
A couple of weeks later, we call and check how they're doing. So we
Yep.
call this a mid-treatment check-in.
Yep.
At the mid-treatment check-in, we say, okay, can we call you now 4 weeks after you finish your treatment?
Yeah.
And at that time, we call them again.
Yeah.
And it's at 4 weeks after they complete their treatment, we do the end of treatment check-in. We say, okay, now if you go and do an SVR4, a test to confirm,
Yeah.
we will then give you a $75 when you show us the results of that test,
Yeah.
irrespective
Of
of
the
its
result.
result, positive
Okay.
or negative.
Okay.
And that's
Okay.
the time when we disclose the second compensation payment.
Right.
But right up front, we always tell them about the first compensation payment is 105 and the randomized amount, because that's what we're studying.
Yes. Okay. And then what is the compensation
For the
amount?
time at the
Yeah.
end is $75.
$75.
So potentially they could get 3 payments,
Yep.
2 compensation payments, 105 right at the beginning
Yep.
and 75 at the end if they've been on treatment and
Yep.
completed and they
Yep.
do their last test,
Yeah.
and the randomized amount of
Okay.
whatever if they were on treatment and initiated treatment. So if right at the onset, 105 they get they've done their test,
Yeah.
but they're negative,
Yeah.
that's it. They do not get their randomized.
They still get
amount.
$105 for
$105.
participating, because they might have cleared it
Correct.
by the time they go and get their blood test.
Exactly.
Oh, yeah,
Yeah.
right. Okay.
So that's generally
Yeah.
that's the processes and the so it's more of an involvement with the participant. So potentially it could be 4 times, but we have to have these different
Yeah.
points of it.
Yeah.
But it can be much more because the two
I was
are
going to say,
going out.
can the participant ring the navigator
Definitely.
whenever?
And that's what happens all the time.
Yes.
So you're not restricted to those 4 contacts.
No.
It's just that
Yeah.
they have the navigator's number.
Yeah.
And that's the relationship that you know,
Yeah.
is formed between the navigator
Yeah.
and the
Yeah.
participant. The navigator does not go through in terms of testing treatment options, or it's more about that conversation is with their clinician. It's more of guidance through the processes and procedures of the project.
Has there been times when a participant has commenced and then for whatever reason doesn't actually complete the treatment and then says, look, you know, can I start again?
Well, we've just rolled out this project at the end of May.
Yes.
So we're still in the journey of a participant, and
Yeah.
we've had so far 144 that have been randomized so
Yeah.
far. And this is across the country.
Yeah.
And we've just, we started off slowly in WA and New South Wales, and we've moved on to, moved into Queensland, which started in Tasmania and Victoria. We just had conversations, South Australia and Northern Territory, just in 4 states so far.
Yeah.
144 that have been randomized.
Yeah.
About 96 that are engaged with the navigator.
Yeah.
and we've had 39 that have initiated treatment. So we've just had a couple that have completed the treatment.
Yeah.
It was the early ones that started at the end of May, June,
Yeah.
and have just progressed so far. So
Yeah.
yes, we
Yeah.
will see as we continue what
yeah.
are our numbers in terms
Yeah.
of that it's not
Yeah.
to the end.
And
we
the
have
project goes until
2025.
okay, what, mid 2025?
Well, beginning of 2025, but it
Mhm.
also depends on how we go
Yeah.
next year.
Yeah.
How many participants we get,
Yeah.
whether the pool of money that has been allocated for incentives,
Yeah.
whether they, you know, because
Yeah.
have we reached that optimum value with our algorithm? Have we, you know,
Yeah.
do we know what that amount is, and therefore it's being,
Yeah.
you know, that is being allocated to our participants.
Yeah.
We'll see.
Okay.
Yeah.
So how many people so far in WA have you got enrolled?
15.
15.
15. Yes.
Okay.
I've been hoping.
Okay.
Next
So there's
year.
probably a lot of people that might be listening to this bite that have gone, I've never heard of this project before. Yeah. Okay. So if you're a service out there, what are you wanting perhaps some health services to do to be a part of this?
My contact details are next.
Yep.
If you require just further one-on-one information sessions for your staff, for just to understand this project further, we don't want any data to be collected from any services. We're just more talking about promotion. So if you're happy to put our posters up, if you think our cards or our flyers will be helpful in fit packs, if you how to engage patients or clients, and you think this project would help them engage and come back, or you know, come in for a treatment, sending in them the link to the project website. So they need to enroll in the project, speak to a navigator before they come for further testing or treatment. So so it's just more about our asking service providers, you know, assistance in terms of promotion, if they feel this project can help them in the existing model of care, cascade of care, but and that's it.
Okay, oh, that's good. Well, I mean, for staff who are listening to this from our Aboriginal Community Controlled Health Services, just to give you an example, Derbil Yerrigan have just signed off on, you know, promoting the Motivate C project. So they've already done an audit of their system. They've of their patients that have Hep C, 67% of those have been treated. So 33% haven't. And so they really want to try and lift up their treatments, you know, and they think perhaps this Motivate C project could be really helpful for some of their patients. So if you, it's definitely, if you're interested and you want to know more information about this, please, you know, please contact Rena. The other thing is, and I think this has sort of come up a few times, is not all waiting rooms actually put posters up. And we know that in a lot of our community controlled health services and in GP practices, but often they'll have a TV going. So if you wanted a digital, you know, tile or about the Motivate C project, Rena would also be able to send you that, so you could actually put that up on your TV screens. I'm just trying to think what else we could be doing.
Articles and newsletters.
Oh, yes.
That's what, you know, different stakeholders have been doing. WAFA has put, you know, news letters that go to practice managers and GPs. You know, currently a blurb of the project is in the notifications letters that are out there. So just different ways.
Or perhaps you're having a one-on-one with a patient. You know, that maybe either has Hep C, hasn't been treated, maybe started treatment, and for whatever reasons, because of their life, they haven't been able to finish their treatment. There's somebody you're wanting to get back onto treatment. Maybe something like this project could be, you know, ideal for them. And they're already engaged in primary health care. So they're sort of already there. It's about then just engaging them with the project and Project Navigator. So, you know, it could be that, or it might be that perhaps where you work, if you're an outreach worker or you're working in an NSP and you're working with clients who are actually at risk of Hep C, just to give them some awareness of, you know, if they are getting tested and they're a newly diagnosed patient, that there is this project that they might want to engage with. And also, if they don't have a doctor or a primary healthcare provider, again, the Motivate C project has their own doctors on board that could also help with testing and treatment. And I think that's, you know, that it just shows that it, you know, it's flexible to the needs of patients. So that's really awesome.
Thank you. Thank you very much, Veronica, for giving me this opportunity.
Yeah.
Well, that's a unique project. Yes.
Yeah. Thank you very much, Rena, for joining us on today's Bite.
Thank you.
All right. Thanks, everyone. See you. Bye.